So today we're going to be talking about aeromedical factors and how those affect us in flight. Our objective is to develop an understanding of aeromedical factors related to aviation, and this is important because these could be detrimental factors to your health in flight. So what we're going to be talking about today is mostly what the medical certificate is and how to obtain one, the options on how to obtain a medical certificate if you have health issues, the effects of alcohol and drugs and their negative results, dangers of flying after scuba diving and its effects, and then some of the descriptions, the symptoms, and the possible solutions to the following: hypoxia and the different kinds of hypoxia, hyperventilation, the middle ear and sinus issues that can happen in flight, spatial disorientations and all of the different kinds, carbon monoxide poisoning, motion sickness, the fatigue and stress that can possibly happen, and dehydration. Some of these things are very self-explanatory, but they're still important to make sure we're aware of and the detrimental effects that can happen because of them in flight. So overall, there are many aeromedical factors that pilots need to be aware of before flying, and even passengers need to be aware of before flying. These being aware of situations and medical conditions that could occur in flight is very helpful in helping us prevent them from happening and detect them when they occur, and then following the corrective action if they are to occur. Things like hypoxia, carbon monoxide poisoning, fatigue, stress, spatial disorientation, upon many other things. So one of the things we can do before flying is the PAVE checklist. The PAVE checklist is pretty much a self-examination that anyone can do before they fly, pretty much go through and just make sure that they're ready to go. The P is going to stand for pilot. This is anything that could be affecting you, like medication, drugs, stress, and then we have the airplane. So making sure that our airplane is airworthy, it is got everything we need in order to fly. And then we have the environment. The environment is part of the PAVE checklist that refers to everything that's, physically around you. Making sure that the weather is good. You're not going because you want to get somewhere and you're avoiding the factors that really come into play, like weather being too bad to fly. And then the last one we have is external pressures. These are things that mostly consist of other people convincing you into doing something that maybe you don't want to do. Maybe you're not ready to fly that day and you've had a lot of things going on at home, you didn't get enough sleep, and your friends are just irking you to go, and they push you to the limit and you're the one flying, and these things should be your decision. So kind of making sure that you're not getting convinced into doing something you're not comfortable with doing, or if the weather is bad. So now we're going to talk about medical certificates. Pilots operating an aircraft are required to hold a medical certificate. However, there are some exceptions, which I'll discuss further on. These medical examinations are to be done by an AME, which is an aviation medical examiner. So in using medexpress.faa.gov, you can go on, complete the application to receive a medical certificate, and then it will give you the option to schedule appointment with an FAA designated doctor. This is the AME, the Aviation Medical Examiner, and they are there to test you, and if you meet the required standards, they will grant you the certificate after they fill out the FAA application form. So medical certificates are classified into 3 types. Like I said, we know what they are, but they are class 1, 2, and 3. They're valid for a certain period of time, detected by the class, pilot's age, and type of operation being discussed. The the requirements for a medical certificate can be found in 14 CFR Part 67. And the validity requirements for medical certificates can be found in 14 CFR 6123. So ultimately, the responsibility is going to fall on the pilot to monitor his or her health and judge if a certain injury or illness will affect the aircraft operation. Although a medical is required, it is still possible to obtain a medical certificate with a medical deficiency. So the AME and the FSDO, the Flight Standards District Office, are the best sources of information for all of this, because really obtaining one of these medical certificates with stipulations is going to be very dependent on the exact situation at hand. So it's hard to give a general basis of what will and will not be allowed, but those will be discussed and determined by the AME and the FSDO. So you can have a medical with certain restrictions placed on it. And then again, this special tests have to happen with a DE. And if you are to be approved with the demonstrated ability to perform certain tasks that are necessary for flight, you may be issued a statement of demonstrated ability, which is separate. This is referred to as a SOTA. Or limitations can be placed on your pilot certificate if you're unable to perform certain tasks. So further medical tests may be required to ensure the pilot's condition won't impact safely too much to fly. And yeah. What Basic Med is an alternate way for pilots to fly with a medical certificate, as long as they are meeting the specific requirements. Now, with the Basic Med, there are a few limitations, and these are that you cannot fly with more than 6 occupants. The aircraft may not weigh over 6,000 pounds. You may not fly over 250 knots and in Class A airspace. And then you cannot fly for hire with Basic Med. So the holders of Basic Med have these limitations, and they must complete an education course every 2 years. These certificates are going to be a medical exam every 4 years by a state licensed physician, and they must have been held and issued a medical certificate after July 14th of 2006. So as mentioned earlier, we're going to be talking about some specific aeromedical factors and their causes, symptoms, effect, corrective actions for them. Hypoxia, hyperventilation, middle ear and sinus problems, spatial disorientation and the different kinds, motion sickness, carbon monoxide poisoning and the dangers of flying with it, fatigue and stress and why to avoid it, and dehydration. Alright, so the first one we're going to be talking about is hypoxia. And hypoxia is one of the most common but also very dangerous factors in aviation. So pretty much the definition of hypoxia is the lack of sufficient oxygen in the blood, the tissues, and the cells to maintain a normal physiological function. So there are 4 types of hypoxia. We have hypoxic, hypemic, stagnant, and histotoxic. So hypoxic hypoxia is pretty much just the insufficiency of oxygen available to the lungs. So as the atmospheric pressure decreases as we fly upward, the partial pressure of oxygen decreases as well. And the percentage of oxygen in the air stays the same, but the molecules don't have the pressure to drive the oxygen into the respiratory system. This is simply caused by the reduction of partial pressure at high altitude. And the next one is hypemic. So this simply means that there is not enough blood. So the blood cannot take up and transfer or transfer the oxygen into the cells in the body. And this can be caused by blood diseases or hemoglobin or giving a blood donation before flying, which is highly unrecommended. Stagnant hypoxia is another kind. We have this is when oxygen is rich in the blood and it's not moving to the tissues, and it can be caused by the G forces or heart just failing to pump the blood sufficiently. The last one is histotoxic. This is simply the inability of cells to effectively use oxygen, and I call this the dumb cells, because it's simply caused by alcohol and other drugs such as narcotics. The symptoms of hypoxia are cyanosis, which is the blue in the fingers, and a headache, euphoria, numbness, and it can bear your judgment, thinking that everything is fine. How we prevent this? Using oxygen at the appropriate flight levels and maintaining a safe flight altitude. The effects are results in a pilot's performance declining gradually. And as I said, they have euphoria, so the situation may not seem to be declining, but your time of useful consciousness is decreasing. And at 45,000 feet, just to give an estimate, it's 9 to 15 seconds, and then it goes all the way up to 20,000 feet, down to 20,000 feet, which is 30 minutes or more. So the corrective action is to just inform the crew and descend below 10,000 feet if the symptoms of hypoxia are starting to arise, and slowing down the breathing rate is highly recommended. Alright, we're going to be talking about hyperventilation next, which is pretty much just breathing at a higher rate than normal. This happens when less carbon dioxide is being pumped into your blood due to the increased intake of oxygen. And the causes of this is emotional stress or pain, fear, anxiety, and this results in an excessive loss of carbon dioxide from the body, and then leads to further anxiety, which further hyperventilation then occurs. So it's pretty much a loophole if you don't go ahead and cure that. The symptoms are headache, impaired judgment, drowsiness, euphoria, muscle spasms, and several different other factors can come into play to warn us of hyperventilation. So in order to treat this, we kind of just need to slow down our breathing rate, and if using supplemental oxygen, check the equipment airflow and ensure that the symptoms are not hypoxia related. Now, the next thing we're going to be discussing is the middle ear and sinus problems, because during climbs and descents, the gas present in body cavities expands, and when you're descending, the opposite happens. So, the middle ear is a cavity located in the bone of the skull, and it is very sensitive to pressure differences. So during a climb, the middle ear pressure exceeds the pressure of the external ear canal, and this causes the eardrum to bulge outward. And during a descent, the pressure of the ear and the external ear canal increases. So the middle ear cavity is equalized with the lower pressure. And at the lower pressure with external ear canal, it causes the eardrum to bulge inward. And this causes a lot of pain, and this is why you do not want to fly with any sinus infection or sinus issues at all, because you could run the risk of blowing out your eardrum. And these symptoms are, like I said, excessive pain, and sometimes you can even have bloody mucus. So this can result in a busted eardrum, and the best thing to do if you are sensing it coming on is slow the descent rate down, because the faster you descend, the more it's going to feel that eardrum bulge. And you can chew gum and blow softly while closing your nose to try and get some of that pressure out. All right, now spatial disorientation. This is the lack of orientation in regard to the position, attitude, or movement of the aircraft. And this is affecting different systems. We have the vestibular system that consists of the semicircular canals and the organs, or the otolith organs. The semicircular canals are what detect angular circulation of three tubes at the right angle of each other. And pretty much the hairs in the canal react to the movement of the fluid in your body, and they send signals to the brain about the perceived position and orientation of your body. And this is where you can get confused in the direction. And this is further leading into the illusion of the leans. This is where the constant turn of the aircraft will make the pilot think that they're adapted to a new banked attitude. And then when the pilot goes out to roll back onto the attitude they thought they were at, they're going to be turning in the opposite direction. So the next one we have is the visual system. This is the eyes, which are the primary source of information for spatial orientation. So this is why it's important to rely on our instruments, especially when IMC, because you're not even able to help with spatial orientation. But with a constant reference to the horizon, eyes are able to correct for illusions produced by the vestibular system. And they are found in the inner ear, and the position by the way we're balanced. So then we have the somatosensory system. And this is what sends signals from the skin, the joints, the muscles, and the brain that's interpreted in relation to the Earth's gravitational pull. So, this is where the nerves in the skin and muscles can send the somatographic illusion. This is the illusion of being pitched up on takeoff. So the acceleration factor of taking off can make you feel as though you are already pitched up, causing you to pull that yoke back and end up in an even more pitched up position. So it's important to be aware of all these disorientations before flying the aircraft so that you can do the best corrective actions as they're happening. Motion sickness is very common, especially in the very beginning of flying, and this can also be called air sickness, but it's caused by the brain receiving conflicting messages about the state of the body. So this can be caused by paying attention to things inside the airplane and not focusing on a specific point on the outside, which is confusing the messages, or it's going to receive conflicting messages in the brain. And abrupt changes in a very short span of time can cause you high stress or anxiety, and then lead to the further symptoms of having nausea, dizziness, discomfort, or even vomiting in flight. And in order to correct this, we need to make sure we're having smooth flying, or letting the pilot know that they need to fly smoother if that's not the case. Focusing outside of the cockpit instead of on the inside, and then opening air vents and getting that increased airflow in so that you're not breathing in the same stagnant air. One of the most dangerous in-flight aeromedical factors is carbon monoxide poisoning. And what makes this so dangerous is that even if carbon monoxide is not detected inside the cockpit, there still may be an excess of carbon monoxide. So what this is a colorless, odorless gas that is produced by engines, and it can be a result of an exhaust leak or a damage in the passageway to the cabin. This can also further lead back into hypemic hypoxia, and this is another danger because the detection of it can be difficult, and so can the symptoms be difficult to tell. So, some of the things to look out for are blurred vision, strength issues, and headache or drowsiness. And the worst possible result is potentially death. And so, in order to correct this as soon as it's detected, is turning off the heater and making sure you're opening air vents and using supplemental oxygen if possible, because exhaust fumes that are smelt in the cabin, it's fair to assume that carbon monoxide is present, and action must be taken immediately. Multiple studies have been done to show that fatigue is one of the leading causes in pilot error. And so, this is why it's very important to make sure that you are not filled with any sort of fatigue and stress before flying. Because, as some may say, to be fatigued is to be impaired. So, what stress is the body's response to physical or physiological demands put on it, while fatigue is associated with, as we mentioned, pilot error. So the causes are potentially outside factors like sleep loss, work, exercise, or complete task saturating factors inside the cockpit. The symptoms are pretty obvious to tell sometimes with fatigue or being stressed, because people generally have a difficult time paying attention or correctly get done multiple tasks at the same time. They tend to separate them out, and they have the inability to communicate correctively and effectively, and their coordination is off. So, with fatigue, there's two kinds. We have acute fatigue and we have chronic fatigue. So, acute fatigue is your more short term, you have timing disruption and you're performing less smooth. You're doing them separately, as I mentioned, and this disrupts your perceptual field. Concentrating on movements or objects in the center of vision, and maybe also accompanied with your loss of accuracy. So this can further lead into chronic fatigue, which is an extended amount of chronic fatigue and an extended amount of acute fatigue, and can be dangerous if it's not treated properly. So overall, don't fly fatigued, and especially don't fly stressed, and get proper rest. With chronic fatigue, one may even need to seek medical help if it extends over a long duration of time. So this may sound silly, but dehydration is also a very, very, very important factor of flying, because not only is it needed to fly, but it's one of the 3 basic needs that we have. And being dehydrated can distract you a lot from doing the tasks that you need to get done. So, to be short, it's pretty much just the critical loss of water from the body, and this can be noticed first through fatigue, and the symptoms are also cramping, headaches, and tiredness. This can be caused from failing to drink enough water, or even drinking things that are not thirst quenching, like tea or coffee or alcohol, and being on hot flight decks, and things can creep on you suddenly. So a good rule of thumb is to drink water about 2 to 4 quarts every 24 hours, and really limiting the intake of alcohol and caffeine overall for several reasons before flying a long duration of time. And this can result in difficulty to perform tasks as well, because if you're thirsty, you're paying attention to things that most likely affect physical need than things around you. And just making sure that you're staying on top of getting hydrated before flying. Or it goes without saying that one should not fly within 8 hours of drinking alcohol, and it states this in FAR 9117. And a lot of good rule of thumb is to not drink 8 hours bottle to throttle. So just remembering that alcohol impairs the efficiency overall of the human body, even if people think that it does not. This reduces the chances of completing a flight without an incident, because even a small amount of alcohol can impair the judgment overall and definitely affects the coordination and decreases strength of the pilots. So, also, drugs and narcotics can be kind of a gray area, but they definitely may negatively affect the ability to fly. Medications must be approved by the FAA from an AME, the Aviation Medical Examiner, and there is a list on the FAA website of the allowable drugs to make a proper go or no-go decision before each flight. Title 14 CFR Part 6153 also states restrictions about flying with a known medical condition, as well as taking any medication before flight. So making sure that you go on there and check to see if you don't plan on taking medication that is not approved before flying is very important before a flight. Although scuba diving may be a very fun vacation activity, it is important to remember the rules when it comes to flying after scuba diving, because scuba diving causes the body to absorb oxygen or nitrogen. And if a person does fly soon after scuba diving, the nitrogen bubbles can form in the blood and then spinal cord or brain and expand. The bubbles